How EEG works. Electroencephalogram, or EEG, is performed by attaching electrodes to the scalp to measure electrical signals induced on the location of each electrode. The signal is assumed to be due to the electrical activity of the brain. Given its temporal sensitivity, the main use of EEG is in evaluating patients with suspected seizures, epilepsy, and spells. EEG is also used to monitor the depth of anesthesia during surgical procedures. It has a potential to monitor complications such as ischemia or infarction during surgery. EEG waveforms are sometimes averaged to get an estimate of evoked potentials, or EPs, and event-related potentials, or ERPs, to measure response to a specific stimulus. EPs and ERPs are used for evaluation of visual, auditory, and somatosensory functioning. Two main problems with EEG are its inability to localize the signal it detects on the scalp and its poor spatial resolution. The state-of-art spatial resolution for EEG is about 15 millimeters. Its use in research and neurology is mainly due to its low price and ease of use that makes it a quick test for some neurological decisions such as patients in coma, Alzheimer's, etc. In contrast, how fMRI works. Images in MRI are generated by detecting signals directly from hydrogen atoms in the brain. Every atom, when stimulated by a radio frequency pulse, will induce a small electrical signal in the MRI coil, which is placed on the patient's head, like a helmet, during scanning. This signal is directly registered and used to produce MRI images. This is in sharp contrast with other imaging techniques like EEG, for example, as MRI can pinpoint the source of the signal deep in the brain, while EEG cannot. Because MRI is very sensitive to the magnetic field, any disturbance in the magnetic field can be measured by MRI. A very sophisticated version of MRI, called functional MRI or fMRI, measures the blood flow to each region of the brain, and this way produces a functional map of the whole brain. The powerful advantage of fMRI is that its data is generated directly from oxygen from blood flow. This means that more activated areas are going to have more blood flow than less activated areas. fMRI allows us to find minute abnormalities in the patterns of brain activities and find signatures of brain disorders. Because this technique is sensitive to blood flow that delivers oxygen to every neuron in the brain, and any activity in the brain needs oxygen, fMRI offers a unique window to every cell in the brain and its activity. Using fMRI allows us to compare the pattern of activity in the brain of healthy people with those of the people with psychiatric and neurological disorders. That enables us to find abnormal regions in the brain with millimeter accuracy. Such accuracy is vital in delivering stimulation such as TMS to the exact location of abnormal neurons. Presently, no other imaging techniques comes close to functional MRI in terms of specificity and spatial resolution. That makes it an indispensable tool for treatment of patients with neuropsychiatric disorders. Come to Neurotherapeutix and let's build your brain. For more content like this, please like, comment, share, and subscribe. Thank you for watching.